get started, I just wanted to talk about the precautions and contraindications when using vestibular equipment. So first and foremost, if a child has a seizure disorder and it's not controlled by medications and seizures are elicited by vestibular input, then equipment is contraindicated. If a child has a seizure disorder and it is controlled by medications and seizures are caused by input, it is indicated. However, it's important to emphasize only linear motion, so front to back, side to side for only short periods amount of time. If a child has a seizure disorder and it is controlled by medications, but it's not elicited by input, it's also indicated as well. But once again, emphasize only linear motions. For general precautions, for some children, thresholds may be different for each child. They may respond differently to vestibular input. Some common signs and symptoms of distress would be sweating, blushing of the skin, pallor skin, flatulence. So when you do observe signs of distress, you would slowly stop the activity and then provide proprioceptive input to the child. So any deep joint compressions, or you can give them a weighted toy, and then you can have them squeeze out. This is the platform swing. I set up suspensions correctly by using proper body mechanics with the notches facing up. The purpose of the swing, or swings in general, is to provide proprioceptive input, vestibular input, and tactile input. So vestibular input as they sway front to back, side to side, and rotary movements. Proprioceptive input as the child is able to push down onto the surfaces of the swing. And tactile input as they feel the surfaces on their skin. Also, for swings in general, children also work with motor planning, so you want them to problem solve on how to get on and get off, what body parts to move, what objects they could pick up, what sequences they could follow. This is a swing to work on your posture, especially working on those extensors when you are lying on your belly. It also helps with your obliques when you're sitting down. Also helps with eye-hand coordination and motor coordination. So as the swing rocks back and forth, perhaps a treatment session, you would have the child on their belly, and then they could pick up various objects, and then they could categorize them into buckets or different colors. It also helps with your dynamic balance. So the child may be sitting, kneeling, or even standing. So let me just show you. So child can be prone, kneeling, or sometimes they can even be standing. One more thing, just be mindful that this platform swing does have a weight limit of 300 pounds. To remove it, to use proper body mechanics, you're just going to grip it here, and then latch it. So this is called the disc swing. So as I mentioned previously, the main purpose of this is to provide vestibular input, proprioceptive input, tactile input, as well as motor planning. So we want the child to problem solve on what body parts to move, what certain movements they can achieve, how to get on and get off. But also at the same time with this disc swing, an emphasis here is working on your trunk, because you need to be able to use your trunk accordingly and efficiently in order to use this swing, and as well as your grip strength. Without your grip strength, you won't be able to use this swing effectively as well as your dynamic standing balance. So the way how this works, child will jump onto it with 2 feet, so just like so. And for example, in treatment for children, let's say if a child wants to role play, they could swing from one pirate ship to the other, or they could pretend they're like Tarzan swinging through the jungle. This is a prone scooter board. As Dr. Gatman mentioned, the therapist would want to be positioned knee by the caster or the front, other knee by the end, and then hand by the child using contact guard assist. The primary purpose of this prone scooter board is to once again provide that vestibular input, that proprioceptive input, once again that motor planning, having the child problem solve on how to get on, get off, what body parts to move, what objects they could pick up, what sequences they could follow. We're also addressing that postural control and strength, especially when they're laying on their belly. They're working on those extensors on the back, head, and neck. Also addressing bilateral coordination and achieving those reciprocal movements of the upper and lower extremities, promoting that trunk dissociation. We're also addressing that proximal joint stability, helping children achieve that crawling motion. Once you're done with it, you would want to place the board upside down against the wall, just so they don't get hurt. And also you want to be mindful of fatigue levels because you're going to emphasize a lot of arm movements as well. So an example of this in play, you could set up an obstacle course or scavenger hunt. A child can be prone. They could pretend they're racing in a car or swimming like a turtle. But depending on other skill levels, they could be kneeling on it or sitting on it as well. For my positioning devices, I'm going to be talking about the therapy ball and the bolster since I'll be using them both for my intervention. So with the therapy ball, it's very multi-purpose. It can provide the stabular and proprioceptive input as kids are swaying and rocking back and forth, side to side, when they are either sitting on it, laying prone, or even supine. By providing proprioceptive input, we can help a child feel more grounded and more attentive to certain tasks because we can increase their focus and concentration. It addresses their dynamic sitting balance as children may balance on the ball. It addresses trunk stability as it rocks, riding reactions, the protective extension mechanisms. It also addresses gross motor skills and coordination as kids can throw the ball, kick it, or catch the ball. An example of this in play would be having the child bounce on the ball while they are performing a puzzle or seeking increased sensory input. For the bolster, a child may use this in prone for weight-bearing activities and getting that proprioceptive input by activating those postural control muscles. This can allow for midline crossing and dissociation of the upper extremities. Also vestibular input, they could sit down and they can rock back and forth. An example of this in play would be an infant may be prone. That infant can be reaching for toys in various directions to target crossing of the midline or can be reaching above their head to promote those postural extensors. It's important to keep the bolster right below the shoulder girdle because we don't want to compress the brachial plexus. This is a weighted toy. The primary purpose of this is to provide that proprioceptive input for children, which can modulate the central nervous system, inducing a calming effect on the child. It makes the child feel more grounded and it lowers their state of arousal. This can be used to improve their concentration, their focus, and their attention. Also, if they may show any signs of distress, as we talked about with the precautions earlier, a child may use this to feel more grounded and lower their state of arousal. So during play, they can role play it, they can pretend this is their actual dog, they could find the dog, help the dog. Also, if they are feeling that distress, as I mentioned, they can catch the dog and squeeze it. We want to make sure that the weighted equipment is not 10 to 15% of the child's body weight. And also, when they are sleeping, we want to make sure that it doesn't obstruct their breathing when they're on top. For my client, for the first intervention session, I'm going to be using the therapy ball. My client, he's 6 months, he has low tone, decreased trunk stability, and an inability to sit up independently. To address his tone, I want to be providing that vestibular and proprioceptive input. I want him to have a sense of the moving environment so he can respond his body accordingly and promote that muscle coactivation via proprioception. To address his decreased trunk stability, I could work on his dynamic core control, primarily his flexors, extensors, and his obliques as it rolls forward and back. So rolling forward and back can help with the extensors and flexors. So when he does move forward, this can promote that forward protective extension, allowing him to sit up propped, which may help him sit up independently in the near future. By swaying side to side, we can also work on those riding reactions, having him get back to midline using those obliques in that trunk. For the second piece of equipment, I'm going to be using a bolster to once again address his low tone, his decreased trunk stability, and his inability to sit up independently. I want to address low tone by providing that vestibular and proprioceptive input by rolling Raj on his belly. Once again, have him understand his environment by adjusting his body and promoting that muscle coactivation. To address that decreased trunk stability, he's going to be placed on his belly. The goal is to have him reach for certain toys that are various directions, or he can have him reach above to promote those extensors in the back. To address his inability to sit up, he's going to be seated. I'm going to be stabilizing his pelvis. The bolster will roll forward, and then once again, as he rolls forward, that forward protective extension will be activated, and hopefully that can help him sit up more independently in the future. One thing to look out for, I'm going to be supporting Raj's pelvis at all times just to provide a stable base of support. And by doing this, you could also control the direction of the ball where Raj is going as well. One more thing to keep in mind
You want to make sure that there is a slight bend to Raj's knee to address that core. Otherwise, if that leg is straight, we're actually addressing the hip and not the core itself. Also, we just want to be mindful of all the vestibular contraindications and precautions for infants. But with Raj, he's pretty okay. So first and foremost, I'm just going to bounce Raj up and down the therapy ball. Let's go bounce, Raj. Itsy bitsy spied, went up the water spout. Down came the rain and washed. Down came the sun and dried up all the rain. Itsy bitsy spider went up the water spout. So we're just gonna bounce Raj on the ball, just to get him acclimated to the movements, and then we're gonna rock him back and forth because he does enjoy that baby swing at the park. So we're gonna be providing that vestibular input as well. So Raj, let's go swing, Raj. All right, so as he comes forward, you want to see that extension of his back, neck, and head, as well as that forward protective extension, which may help him sit up propped in the near future. All right, so we're gonna go back, see if Raj can bring his flexors up, which he can. Good, Raj. And then we'll just go back and forth. Raj, reach. Good. And then I'm gonna sway Raj side to side just to address that riding reaction. So Raj, over here, Raj. And as you can see, as we tilt him towards the side, he does his best to come back to midline as well. So let's swing a couple more times just to get him happy. And that'll be it. Okay, so first and foremost, we just want to make sure that the bolster is right below the shoulder girdle because we want to avoid compression to the brachial plexus. And also we just want to stabilize Raj's pelvis if ever the bolster rolls forward, just to provide a stable base of support at all times. So what I'm going to do is I'm going to lay out a couple toys for Raj for him to reach, and let's see if he could do it. Okay, Raj, over there, go reach for the toy, Raj. Good. Let's see if he drops it. Rock him back and forth. And then, sorry Raj, I'm gonna take it from you. I'm gonna bring it up. Let's see if he could work those extensors. So Raj, over here, Raj. Reach for the toy, Raj. There you go. And he got it. Let's swing, Raj. Woo! Up and down, up and down. Okay, Raj, reach for the toy, okay? Reach, reach, reach. Woo. Let me help you out. Reach, reach, reach. Very good, Raj.